Welcome to the COVID-19 update for today, September 19, 2022. And as usual, we'll be speaking with the Minister of Health, Dr. Frank Anthony. First of all, how many new cases have we recorded in the last 24 hours? And what's our current active case count?
So in the last 24 hours, we had 7 new cases, and our active case count right now is 119.
To have a better understanding of what's happening in terms of COVID, can you provide a regional breakdown of those cases that we have right now?
So of the 119, we have 2 persons in Region 1, we have 7 in Region 2, we have 19 in Region 3, 59 in Region 4, 4 in Region 5, 6 in Region 6, we have 19, Region 7 we have 3, Regions 8 we don't have any cases recorded, Regions 9, 5, and Regions 10, 1.
Minister, how do we stand in relation to our hospitalization status for COVID-19?
So we have 6 persons in hospital, 5 of them in the Ocean View Hospital and 1 person in the ICU.
Turning our attention a little bit to monkeypox, has the Ministry of Health reported any new cases of that virus?
No. We had 2 cases, and so far we have isolated them, treated them, and they are now discharged. So they are non-infectious, and we haven't detected any new cases.
Is the ministry also following up with these patients to track their recovery after being released from hospital?
At this point in time, there's no need for any further follow-up, because when we discharged them from the hospital, they were symptom-free.
Dr. Anthony, on September 17th, we observed World Patient Safety Day. Can you give us a brief overview of what that day is about and the symbolism behind that day?
So one of the things that we want to make sure is that when people come to the health system, that patients feel safe, they're in a safe environment, and whatever meds they're getting, that this is also the right and appropriate meds for their health condition. From time to time, however, there can be mistakes. So for example, if the prescription is not properly filled, if there's a substitute medicine that is given, if the interaction between various medications are not taken into account, these can lead to complication for patients. So on last Friday, which was the day where we were highlighting patient safety, efforts were made to reinforce the need to have quality measures in place to make sure that these mistakes do not occur, to minimize them. And this would mean that we have to constantly train our staff, make sure that there is adherence to proper guidelines, and if there's any doubt, for them to seek advice from more senior persons within the system. So we want to reinforce that, and so that any patient that comes to us, we can minimize any error occurring.
This has been the COVID-19 update for today, September 19, 2022. For more information, feel free to visit the Ministry of Health's website at health.gov.gy or DPI's website, dpi.gov.gy. For DPI, I am Shaquan Bin.